Annyeonghaseyo. Good morning, everyone. I'm Dr. Prashant Meshram from Johns Hopkins University. I'll be presenting one of our researches, which is titled "Can Metal Artifact Reduction (MRI) Help Us to Diagnose Periprosthetic Shoulder Infection?" These are the disclosures from our radiology team. PSI have a prevalence of up to 4%, and the diagnosis is difficult because the clinical presentation is usually non-specific pain. No frank clinical signs of infection are present. The blood investigations of ESR, CRP, the synovial fluid, aspirate cultures are typically normal. Radiographs and CT scans have low accuracy. Standard MRIs have drawbacks because it has limited tissue visualization, and ICM 2018 meeting notes have described it as of little value and is seldom used for diagnosis of TSI. Instead of a standard MRI, use of meta-artifact reduction sequence in MRI gives improved quality of evaluation of MARS compared to standard MRI. It leads to unmasking of bone edema and resorption, the signs which could be suggestive of PSI, as it can be seen on the right side. MARS MRI has proven to be effective to diagnose PSI in 85 to 90% accuracy in hip, knee, and ankle arthroplasty. But the same accuracy has not been described or studied before for shoulder arthroplasty. The purpose of this current study is to determine the accuracy and reliability of MARS MRI for making the diagnosis of PSI. We also try to identify the group of findings which can increase the probability of diagnosing PSI on using MARS MRI. We included patients from outpatient clinic who were suspected to have infection and had a painful shoulder arthroplasty. Most of the patients out of 89 included had reverse total shoulder arthroplasty, and the rest had hemi or anatomical TSA. In our patient cohort, we decided whether the patient belonged to infected or non-infected group based on the ICM 2018 criteria definition. In infected group, we had 22 patients. In non-infected group, we had 67 patients. Standardized MARS MRI protocol was applied for all the patients using a 1.5 Tesla MRI scan, and the metal reduction sequence used was CMAC. Evaluation of MARS MRI studies was standardized with two musculoskeletal radiologists with experience of over 10 years reading all the MRIs. They read it in a blinded fashion, in randomized fashion, and independently, and finally in the consensus. They did image quality assessment, and inter and intra-reader reliability was done. Primary outcomes were detection of 10 abnormalities which could be suggestive of PSI. Overall image quality was found to be good to excellent agreement between the two readers. Intra and inter-observer reliability was also found to be good to excellent. In terms of diagnostic accuracy, three particular findings of lymphadenopathy, complex joint effusion, edematous synovitis had the highest accuracy, sensitivity, and specificity for diagnosis of infection on MARS MRI. Sinus tract and rotator cuff muscle edema had very high specificity, but the sensitivity was low. These are the representative images where the arrow shows us how lymphadenopathy actually looks on MARS MRI. These are the representative images of edematous synovitis and complex joint effusion on MARS MRI, which could suggest us that this is a case of periprosthetic shoulder infection. A randomized forest analysis also showed us that these three findings of edematous synovitis, lymphadenopathy, and complex joint effusion are relatively important for the diagnosis of PSI. When considered these three findings together, lymphadenopathy, complex joint effusion, and edematous synovitis indicates that there is a chance of infection of over 99%. If all these three findings are absent, then one could say that there's almost nil chances of diagnosing PSI on MARS MRI. So in conclusion of the talk, MARS MRI is a useful tool for evaluating patients with periprosthetic shoulder infection. It has good inter and intra-reader reliability. The findings that carry high likelihood of diagnosis of PSI are lymphadenopathy, complex joint effusion, edematous synovitis, and a combination of these three have a 99% chance of diagnosing PSI. From Johns Hopkins University, we thank everyone for your attention. Thank you, Korean Shoulder Elbow Society, for having us. Have a good day and be safe.